Hi, good evening, Kathy.
Good evening.
Hi, my name is he am nurse practitioner student. So today I'm going to check your vessels and check your abdomen. Is that okay for you?
Yeah, sure.
Yeah. Firstly, I will check your vessels first. Okay. So I will palpate like the extremity arteries. We'll start with your carotid artery. All right. And check the other side. Let me check your bronchial artery. Make a comparison and the radial artery, both sides. All right. Uh, check the femoral arteries and the popliteal arteries. Good. And posterior tibial arteries and the dorsal pedis artery. So good. So all the like the extremity artery, there I can feel the pulse, and the amplitude is expected. Number two on scale 0 to 4, and it's symmetrical. The rate is about 70 times per minute, and it's regular and consistent. All right. Next, I'm going to osculate. I will use a pair of my stethoscope. So the aortic artery and the bilateral renal artery is about 3 centimeters laterally above umbilicus. And the iliac artery is about 3 centimeters below the umbilicus. And also the femoral artery. Okay, good. I don't hear any abnormal roots. So the next I'm going to check the jugular pulsation. So when you are lying down, I can see like the external jugular vein is very obvious, and also it's in terms of the form, the waveform, it's a double wave, and it's not palpable. Uh, it can change with the patient like position. When I move a band, I can see the external jugular vein, the distension reduced, and also it changes with the respiration too. However, for the carotid artery, firstly it's palpable, and secondly it does not change with the patient's position, and also doesn't change with the patient's respiration, and it's only like a single waveform, not double waveform. Okay, so next I'm going to check your external jugular vein pressure. Okay, that's good. So it's about 45 degrees. So this is the highest. Like area of the distension, and this is the suprasternal notch. So I will measure like the distance. Good. It's 3 centimeters. That means uh, the external jugular pressure is 3 centimeters. Now I'm going to inspect like your skin Is there any
No skin
tenderness?
No.
Any lesions?
No.
And also the nail bells is pink. And the fill time is 1 second. Check everyone. There's no cyanosis. And also check the legs. So there's no lesions. Skin is warm. Check every nail bed. It's a pink color, no cyanosis. And the computer refill time, it's 1 second. So there's no edema. Could you stand up? Let me take a look to see any varicose. Good. Alright, so I don't see any varicosities. Okay, now I'm going to check your abdomen to see any abnormal. Let me take a look at the skin. Good. Peptide characteristic in color. And let me take a look at the back. Good. And the surface is the same with the rest of the body. Okay, it's symmetrical. I don't see any mass, any lesions. Okay, take a deep breath for me. Okay, so the movement is smooth and it's symmetrical. All right, you can lie down. I don't see any veins on your abdomen. If there's someone, so the venous return, if it's above the umbilicus, the venous return should be go to the head. If it's lower than the umbilicus, the venous return should go to the feet. And also it's symmetrical, and the umbilicus, that's the maximum height of the curvature. Okay, so now I'm going to check your muscles. Could you lift your hand? That's good. Okay, I don't see any mass, any separation of muscles. There's no hernia. So next I'm going to auscultate. So I will use the diaphragmatic part to auscultate the all four quadrants. So this is the left upper quadrant, 20 to 30 times per minute. This is the left lower quadrant, the right upper quadrant, and the right lower quadrant. Okay. As I said, the bowel movements are present in all four quadrants. There's no decreased tone, no increased tone. There's no paralytic ileus. Next, I'm going to check your arteries roots. I'm going to use the bell of my stethoscope and listen to your aortic artery. So it's the distance from the xiphoid to the umbilicus about two-thirds. And it's a bilateral renal artery. It's about 3 centimeters above the umbilicus, both sides. And the bilateral iliac artery, both sides. It's about 3 centimeters below the umbilicus. I will use the diaphragmatic part to check the friction rod. Okay, so there's no grooves, no friction rod, no venous heart to do the percussion of the all quadrants. to check all the four quadrants. The sound, the percussion sound, it should be like tympanic sound and also the downy sound. The tympanic sound is from stomach and the intestine, and the downy sound from your organ like liver or your spleen. And next, I'm going to measure the liver span. So I will start from the middle clavicular line, from the tympanic sound, then go upward. So once I hear the sound change from the tympanic sound to the downy sound, that's the inferior border of the liver. So I will make a mark. The upper border. So I will start from maybe the third rib. It's still a renaissance from the lungs, and it go downward. Okay, so when you hear the downy sound, that's the upper border of the liver. Now use a ruler to measure it. So it should be from 6 to 12 centimeters. All right. So you are 7 centimeters. So if it's over 12 centimeters, that means you have a liver enlargement. The next one, I'm going to percuss your spleen. The spleen is the left side. So it's the lateral part is the middle axillary line. So this is the lateral line. And the inferior line is just the costal margin. The sixth rib is the upper border. Okay. Gastric air bubbles. It is located in epigastric region. So you can hear a tympanic sound, which is lower than the tympanic sound from the intestine. Okay, next I'm going to do the palpation for you. There are three types of palpation: the light, the medium, and the deep palpation. So today I'm going to show two: the light palpation and the deep palpation. Right. So at the beginning, I'm going to warm my hands, and could you bend your knees, please? Thank you. So in terms of light palpation, it's compress the abdomen no more than 1 centimeter, and in circular motion, and ask the patients, do you have any pain?
No.
Any tenderness?
No.
No, good. Okay. So in the light palpation, there's no mass, there's no muscular tenderness, no muscular resistance, there's no tenderness, there's no masses. All right. And then the next I'm going to do the deep palpation is the umbilical. So the umbilical, there's no bulges, there's no nodules, no granulations, and it's a wrong. Is there any pain? No? Okay. Then I will move to the liver border. So liver border, I put my left hand under your flag, then elevate the flag and make the liver closer to the abdominal wall. And use the right hand to compress and deeply ask the patient, could you take a deep breath for me?
Okay.
Okay. So I don't palpate the liver, but that's a normal finding. So And now I'm going to move to the like the gallbladder area. So the same thing. So take a deep breath for me. Okay, good. I don't feel the gallbladder. Now go to the spleen part. Okay. Take a deep breath. Good. I don't feel the spleen is not palpable. Now I'm going to do the kidney. So the left kidney. Okay. Take a deep breath for me. Good. The left kidney, I don't palpate it. And let me try the right one. Okay. Take a deep breath. Now still don't feel the right kidney, but in some thin patients, we may palpate the right kidney. The next, I'm going to check the aortic pulsation. So I can use the thumb and the fingers. I can feel the pulsation. It is in the middle line. So the last part will check your costovertebral angles for tenderness from the kidneys. This is the costovertebral angle. Any tenderness?
No.
Pain? This side?
No.
No? All right, good.